and welcome to this week's edition of NHIS in a Week. In the headlines, NHI holds nationwide blood donation exercise to commemorate 20 years anniversary. NHI World Bank partner to build capacity of Tier 3 NHI's credentialed healthcare facilities. PSGH partners CPC Cape Coast to mark World Diabetes Day. To commemorate the 20th anniversary of the National Health Insurance Scheme, the NHIA has organized a nationwide blood donation drive. The exercise is aimed at collecting blood from voluntary staff to help save lives in various health facilities across the country. The Deputy CEO in charge of HR and Administration, Dr. Mrs. Yapuku Abeidin, noted during the launch at the authority's head office in Accra that the blood donation exercise is part of the authority's corporate social responsibility.
Blood donation is an altruistic venture or gesture. What I mean by that is that when you see somebody donating his blood, it means that he's engaging in a selfless act, because it isn't everybody that will offer himself for that. It's very important.
That is happening, which is the blood donation, and it's not only happening in the Eastern region but across the country. Every regional office, in collaboration with other key stakeholders, have come together to save lives. We've come together to pool blood, which is a very essential component in our existence as human beings. If it is that we don't get to use the blood, at least our family, our friends, and others out there who are in dire need of blood will be able to enjoy your generosity. So colleagues, this is not a day for speeches, it's a day to come together and to celebrate the scheme, to celebrate humanity, and to say that together, let's continue to save lives. And may God bless you all, may God bless NHI.
Moving on, the World Bank, in partnership with the National Health Insurance Authority, trained on day one about 160 Tier 3 health providers from 5 districts on expedited claims generation and submission in the Upper West region. The first day's training workshop of 5 districts was held at the Blue Hill Hotel Conference. The training program was attended by senior management officials from the NHIA. The acting NHIA director for the Upper West region, in his introductory remarks, called on service providers to render quality services to NHI's members.
I wish to urge all of us to support the facilitators so that we can have a very successful program and go back to our various facilities and see how we can utilize the knowledge we are going to share here today to improve on our claim generation and submission, and thereby, in a long way, to improve on the quality of care that invariably our members will be driving from your various places. And the category of providers here today represent the larger category of all our providers. And you also attend to the larger proportion of our members. So if we get it right, the scheme can be sustainable, and all of us will continue to be beneficiaries of this valuable project NHIS.
In his brief remarks, Mr. Gideon Akonde, the director for CPC Tamale, briefed participants on the need to submit quality claims.
This training is to help you generate and submit your claims very effectively, very efficiently, and timely, so that the NHIA can also expedite action in processing the claims and making payments following a partnership with the World Bank. Over the years, we have had the issue of delayed payments, which has always been a complaint for a large part of our providers. And we all know the challenges around it. The NHI, in its proactive efforts in ensuring this problem is curtailed has come into some partnership with the World Bank to provide funding so that we can pay the claims as quickly as possible for the largest tier of our health provider system in Ghana, that is the tier 3.
The Northern Belt Director, Mr. Titus Sori, said the Upper West region has achieved universal health coverage, which means 80% of the population is covered by the NHIS membership.
The hardest hit regions because utilization is high, claims high because you have a high active membership. And so, as it was well explained to you, it is good enough to submit a very clean claim. Processing will be fast and reimbursement in 90 days will drop in your account. What else would we want more than this?
National Health Insurance, NHIS, your access to healthcare, Eye Mobiara, Eye Hawafe, Enyona Miakata. Tivoti so come, you for come register, you and your family, NHIS, your access to healthcare, National Health Insurance, National Health Insurance, you for come register, you and your family, NHIS, your access to healthcare, National Health Insurance, National Health Insurance, National Health Insurance, NHIS, your access to healthcare,
Every 14th November is World Diabetes Day, a day set aside to create awareness about diabetes mellitus. As part of the activities to mark this year's celebrations, the Pharmaceutical Society of Ghana, in partnership with the CPC Cape Coast, embarked on a free screening exercise to enable staff ascertain their status and potential risk to diabetes mellitus. The screening was preceded by a sensitization lecture with focus on the risk factors, symptoms, complications, and management of the disease. To our final story, in recognition of his immense support and contribution to the empowerment of women and children in Ghana, the Chief Executive of the National Health Insurance Authority has been honored by a civil society organization known as Advocate for Fair and Legal Access, AFLAG Ghana. The Women and Children Support Award was conferred on Dr. Bernard Okoboy at the AFLAG Philanthropic Award and Charity Night held at the La Palm Royal Beach Hotel. The event was under the theme Honoring Heroes, Empowering Change Together.
The life of Dr. Bernard Okoboy is a living testimony of what poor and vulnerable can achieve with encouragement and support. And it's in this regard that we appreciate what AFLAG is doing, and NHIS is willing and ready to support AFLAG in whichever way possible to do more of what they are doing. Thank you very much.
Next is Health Tip. We take a look at diabetes mellitus. This is how we wrap up this week's edition on NHIS in a Week. For more stories, do log on to our website on www.nhis.gov.gh and follow us on all our social media platforms displayed on the screen. My name is Jane Shermatin. Thanks for watching.